Does the genitourinary system change with age? Have you ever wondered how aging affects the genitourinary system? As we get older, this system undergoes notable changes that can impact bladder health and function. One significant change is in bladder capacity. As we age, the bladder's ability to hold urine decreases. The bladder muscle, called the detrusor, and the pelvic floor muscles weaken. This can lead to increased frequency of urination, urgency, and even incontinence. Overactive bladder becomes more common in older adults, though it can affect younger people too. Another change involves bladder sensitivity. Older adults often feel the urge to urinate at lower volumes than before. This increased sensitivity can lead to discomfort and frequent trips to the bathroom, even without any infection. Postmenopausal women may experience this more intensely due to hormonal changes that thin the bladder lining and affect muscle control. Hormonal influences also play a crucial role. In women, declining estrogen levels after menopause can lead to thinning of the bladder lining and weakening of the muscles that control bladder function. In men, lower testosterone levels and prostate enlargement can affect urinary flow and bladder function, leading to symptoms like urgency and nocturia, which is waking up at night to urinate. With age, there is also an increased risk of bladder conditions. These include bladder infections, bladder stones, and even bladder cancer. The risk of bladder cancer rises with age, partly due to cumulative exposure to harmful substances and changes in bladder tissue integrity. Symptoms like frequent urination and urgency can sometimes overlap with signs of bladder cancer, making it essential to seek medical evaluation for persistent urinary symptoms. Lifestyle factors and other health conditions can impact bladder health as well. Chronic dehydration, certain medications, diabetes, and neurological diseases can worsen age-related bladder changes. Additionally, lifestyle habits such as high caffeine intake, smoking, and obesity can contribute to these issues. Constipation, which is common in older adults, can also irritate the bladder by putting pressure on it, worsening urinary symptoms. To support bladder health, it's important to stay well hydrated. Regular medical checkups can help with early detection and management of any bladder symptoms. Engaging in pelvic floor exercises and making lifestyle modifications can improve bladder control and reduce symptoms of overactive bladder. Being aware of changes in urinary patterns as we age can help differentiate normal aging from conditions that may require treatment. In conclusion, the genitourinary system experiences various structural and functional changes with age. These changes can affect bladder health and increase the risk of bladder-related diseases, including bladder cancer. Understanding these changes is key to better prevention, early diagnosis, and effective management of bladder conditions in older adults.